In this video, we will explain how to give tube feeds at home using the bolus method. Please refer to your tube feeding at home booklet provided by your dietitian. This booklet has the details of your personal feeding plan, also known as your feeding regimen, important information from your dietitian, and the written instructions on how to give bolus feeds. These instructions are what we will be going through today. The correct feeding position. You should never give your feeds while lying completely flat. Sit upright in a chair or lay down with your head raised at least 30 degrees. You can use pillows to prop yourself upright, and try to stay in an upright or elevated position for 30 to 60 minutes after a feed finishes. The reason we need to stay upright is so gravity can help the feed go down into your intestines and not up where it could make you cough and potentially go into your lungs. If you start to cough, choke, or have difficulty breathing while feeding, stop the feed and contact your health carer immediately. In an emergency, call 000. Some tubes come with clamps. If you have a nasogastric tube or a nasojejunal tube, you don't need a clamp and you can skip the steps that mention clamping. Step 1. Wash your hands. You will need to wash your hands before handling the equipment. Wash your hands with soap and warm water. This will prevent germs and potentially harmful bacteria getting into your feeding tube and making you unwell. Step 2. Gather equipment. You will need an ENFit syringe, your feed formula, tap water, making sure it's safe drinking water, a clean cloth or paper towel, 2 cups, and your feeding regimen. The formula will need to be room temperature. If your formula has been in the fridge, let it sit out for about 30 minutes to get to room temperature before using it. Step 3. Prepare the feed and flushes. Open the feed bottle and pour it into a cup. Fill a separate cup with water. Step 4. Flush your feeding tube before a bolus. It's important to flush your tube before feeding to check that your tube isn't blocked. Put the towel on your lap or on the table to catch any drips or spills. Using your ENFit syringe, draw up your prescribed volume of water from a cup. Close the clamp on your feeding tube and then unscrew the end of your tube. Screw the syringe into the feeding tube a quarter turn, like 12 o'clock to 3 o'clock on a clock face. Do not over tighten. Unclamp your feeding tube. Make sure you're in a comfortable upright position and then slowly push the syringe plunger to push the water through your tube. Close the clamp on your feeding tube. Unscrew the syringe. Then repeat until you've given your full flush volume as written in your regimen. Step 5. Giving the feed. You will need a syringe and your cup of feed formula. Using the same syringe, draw up your prescribed feed volume from the cup of formula. Check that your clamp is closed. Then gently screw the syringe into your tube. Only twist a quarter turn like 12 o'clock to 3 o'clock on a clock face. Make sure you're in a comfortable upright position or laying with your head elevated by 30 degrees. Unclamp your feeding tube and then very slowly push the syringe plunger to push the feed through your tube. The feed formula should be pushed in more slowly than the water flushes to prevent nausea. Close the clamp on your feeding tube, then unscrew the syringe. Repeat this step until you have given your full feed volume specified in your feeding regimen, as set by your dietitian. Step 6. Flushing your feeding tube after a feed. Just how you flushed your tube with water before giving your formula, we need to flush your tube again afterwards. Using your syringe, draw up your prescribed volume of water from a cup. Check that the clamp on your feeding tube is closed, and then gently screw the syringe into the end of your tube a quarter turn. Unclamp your feeding tube. Push the syringe plunger slowly to push the water through your tube. Close the clamp on your feeding tube. Unscrew the syringe and then repeat until you've given your full flush volume as written in your regimen. Step 7. Ending your feed. When you have given your prescribed volumes of feed and flushes, check that the end of your tube and the cap of your tube are clean. If you don't clean your tube properly, the formula can dry under the cap and become stuck shut. Gently screw the cap back on your feeding tube. Only twist the cap a quarter turn, like 12 o'clock to 3 o'clock on a clock face. Stay upright or semi-reclined for 30 to 60 minutes after you finish your feed. This is so gravity can help the feed go down into your intestines. Cleaning your equipment. After each feed, you need to clean the syringe so you can reuse it. If your feeding equipment isn't cleaned well, there is a risk of potentially harmful bacteria growing on the equipment, which could get into your feeding tube and cause illness. Remove the plunger of the syringe and wash the two parts separately with warm soapy water. Then rinse in warm water and leave them to air dry in a clean place. Once dry, place the syringe in a container with a lid and store in the fridge. Do not microwave your feeding equipment and do not soak in antibacterial products. Store your unopened feed formula in a cool, dry place. Don't leave your formula in the sun or in a hot car, as this may spoil the formula. And do not heat up your feed formula. Medications. Before putting medications through your tube, check with your doctor or pharmacist if the medicine comes as a liquid, if the medicine can be crushed, and whether you need to take it on a full or empty stomach. Tablets should be finely crushed and mixed with water to make a soup-like mixture. Even small, uncrushed pieces can block your feeding tube. Do not mix medications with your feed formula, and do not mix medications together. Prepare your medications and then give them immediately via your tube, and do not let prepared medications sit out. Giving medication via your feeding tube. If the medication requires preparation like crushing and mixing with water, do this now. Using a purple ENFit syringe, flush your feeding tube with 30 millilitres of water. Draw the medication up into the syringe. If there is a clamp on your feeding tube, close it. Gently screw the syringe into the medication port of your feeding tube, or to the end of your tube if a medication port is not available. Unclamp your feeding tube. Gently push in the medication. Then close the clamp on your feeding tube before unscrewing the syringe. If you need to give more than one medication in one sitting, give at least a 10 milliliter water flush between each medication. After giving your last medication in this sitting, flush your tube again with 30 milliliters of water to remove all traces of medication in the tube. Then replace the cap on the medication port or the end of your tube. Ordering formula and equipment. To order more of your feed formula and syringes, refer to your Home Nutrition Program ordering handbook. If you do not have a script for our Home Nutrition Program, speak with your dietitian about how to order your formula and equipment. For more information about your tube feeds, refer to your Tube Feeding at Home booklet.